This is the FM Gold channel of All India Radio. In the program Spotlight, now we bring you a discussion on coronavirus and preventive measures. The participants are Dr. Ashutosh Biswas, medical expert, and Aditi Tandon, journalist.
The first case of novel coronavirus 2019 was reported in Wuhan city of the Hubei province of China on December 31st, 2019. And we know, Dr. Biswas, that the virus has spread very fast. In a matter of just 1 month, we have seen 170 deaths in China and around 7,000 cases in China alone. And we've also seen exportations of the virus in 15 countries. India today reported its first positive case of the novel coronavirus, whose outbreak has been located to Wuhan city in China, but which is now spreading fast and wide. So I just wanted to understand from you that the government and health minister, Mr. Harshvardhan, has advised abundant caution to people, especially to people who have returned from China over the past 1 month, because China is the epicenter of the virus. The country detecting its first positive case today in Kerala, how worried should we be?
This is very important now, this coronavirus spreading faster across the world. So finally India is also having positive cases detected in Kerala, and the student who was standing there in directly contact. And this is the virus which has come from especially China epicenter, definitely. At this moment in India, we don't have much cases. Probably those who are exposed and studying in China and might have contacted that person, disease person over there and got the virus over. So in this scenario, in this situation, that we have a very limited person, but as we know, understand the dynamics of this transmission of this disease from one person to another person is very faster. Because once this is a genetic disease and spill over from animal to the human. Now human to human transmission is very fast. That's why it is spreading from one corner to the another across the world. And India is now detected one. We should not be worried about this disease much because the mortality is not that much high, because this is a coronavirus, one type of RNA virus is similar to that of SARS and MERS, that respiratory viruses. So it causes basically respiratory symptoms, then pneumonia and maybe kidney and liver, other organ involvement. In that way it causes the severity and may likely to cause death in some patients. But at this moment you have reported that 170 cases died due to this coronavirus, and mostly from this one city, Hubei province of China. Compared to the other coronavirus like SARS and MERS, the mortality is about 2.1%, but where this other coronavirus
So what you are essentially saying is that the fatality rate from novel coronavirus is lower than the fatality rate caused by the coronaviruses which led to Middle East Respiratory Syndrome, which is MERS, and Severe Acute Respiratory Syndrome, which is SARS-CoV. So this is a new kind of virus. And also, Dr. Biswas, the WHO is working closely with the Chinese authorities to find out where has the virus originated from, and right now we do not know the cause. All we know is that it has come from animals to humans and now is transmitting from humans to humans, but the source is yet to be detected. I want to understand from you is, what is your message to some people who may have returned from China over the past 1 month, because the government has issued a specific advisory to such people saying that since the incubation period for novel coronavirus is 14 days, therefore if you are experiencing respiratory stress and you have returned from China in the past 1 month, you should immediately self-report on the Government of India helpline, which perhaps you can also tell our listeners.
This virus is spreading from the epicenter of the China across all the countries in the world. More than 20 countries now are affected. And what exactly we are doing to cut down the transmission? We are checking at the airport level, at the water connected area, the Navy Center, that port, and then probably land. So exactly we are looking for the patient who are symptomatic, and we have a thermal scanner put over there to know the temperature. Here sometimes the patient may not have any symptoms at that point of time, and he is having the travel history from the China. So what happens if these people are going back to the community and meeting the family members, and the incubation period is still there and yet to develop the disease, the symptoms. So, whether the patient is symptomatic, any passenger is symptomatic, not symptomatic, we need to know that from the last date of exposure till 14 days, you have the risk of developing the symptoms of disease. So, if government failing to checkpoint of entry, if somebody after that even have developed some symptoms, should respond, should the self-reporting is advisable, and this is really going to cut down the transmission further into the community. So that should be motivated and should be communicated to the people, those who are coming from the outside India, and also sometimes directly now many passengers coming from China or maybe indirectly.
Right. So what you are saying is self-reporting, especially by people who have returned from China over the past month and who are experiencing, I think WHO has put out a list of common symptoms for this disease, and these are cough, fever, difficulty in breathing. And this can be reported to the Government of India 24/7 helpline, which is 011-2397-8046. I am repeating 011-2397-8046. Coming back to the disease itself, Dr. Biswas, we are now also hearing that the Government of India is going to evacuate most of the Indian students studying in Wuhan University and other areas in China. And 2 Air India flights have been earmarked for the purpose, and we are waiting for Chinese approval to fly back our citizens. A lot of countries have already evacuated their citizens from China as a matter of abundant caution. What happens to these people once they come back to India? The government has said they will have to be quarantined for 2 weeks. Where will they be kept?
Already the case which is reported positive is also from Wuhan city, the student. And if we bring this kind of these people all Indian citizens, then definitely we are at risk of inviting the disease to our country. We have to be very serious that these people, those who are at risk, high risk, because directly coming from the China, might have the infection. So we need to follow them up till the incubation period is over. That is usually 14 days. So they ideally should be quarantined. Now the difficulty is that government or the different administration level may have where you are going to put, how you are going to do that. That may create some panic among these people, and travel information to these people may not really give a good sense of message, and it will create different negative impact on the disease, of course. But one is that self-reporting, that one is easy way that these people should be advised strictly to remain at home. That is a home quarantine. That's the people, those who are coming, and strictly they should not mix with the people until 14 days. That is a self kind of advisory. But how these people are going to follow, that is questionable. They are strictly following this.
No, but I'd like to interrupt you here, Dr. Biswas. You just said that 14 days is the incubation period, which means that even in this incubation period, if these people who are at high risk and who are returning from China get in touch and get in contact with anybody, any member of the family, any relative, any friend, they put them also at high risk. So the understanding that we got from Health Minister Harshvardhan's statement 2 days ago was that the Government of India will organize for their quarantine for 14 days. Isn't it so?
That is one of the other ways. The government is thinking probably these people, those who are coming from, should be quarantined in a different, exclusive places. Government is going to decide where should be the suitable place for them to keep them until the incubation period is over. That is also there in mind. So government is already clear about that. So I am giving the alternative. Sometimes the government directly people coming. Now there are many people are going as a tourist by other countries coming to India, and subsequently they develop the symptoms. Like this, many people, those who have not visited China but visited other countries. So now all the countries are affected, almost 20 countries around. So that indirect also exposure that we should also keep in mind.
What is the general precaution that general public should follow? Because as you just explained that this particular form of virus normally causes cough and cold, which is normally also, Dr. Biswas, common in this season. How does a person sitting at home experiencing fever, cold and cough rule out that he or she has novel coronavirus? There can be panic in Indian homes right now.
I've experienced that common cold, these are all just influenza, respiratory syncytial viruses, and there are other non-serious pathogenic viruses are there already. Initially, it is very difficult to distinguish by ourselves that yes, I have a viral fever, then I sit for 2-3 days until we experience a severe cough, severe breathlessness, kind of things, and gradually we become weak and different organ involvement. So it's a acute respiratory symptoms like involvement. One should not really try to identify that whether I am having corona or something. I will advise if any symptoms like flu symptoms at this moment should go immediately to a doctor, and then doctor is going to decide based on the symptoms what kind of action to be taken immediately. Because there is no point. Second thing, that if anybody having this kind of symptoms, flu-like symptoms and illness, he should not go around. He should really take rest at home because he is likely to spread the disease and then go to hospital to take advice what should be done next.
So what you're effectively saying is anybody experiencing cough, cold, fever and respiratory stress is advised to see their doctor, and the doctor, depending on symptoms, is going to check whether this is normal flu or this needs further investigation.
Yes.
Government of India has already sent out protocols to all officers and has also set up district and state level surveillance units. An advisory was also issued yesterday, Dr. Biswas, by India, saying that everybody should refrain from travelling to China. So it was the first travel advisory that India issued yesterday. Plus, as you said, the evacuation plans are underway. What is also your message, considering the WHO is holding an emergency committee meeting today to decide whether novel coronavirus is public health emergency of international concern?
Yes, this is a very serious challenge to declare these public health emergencies. You understand, if one country, and now this is a global challenge now, China is there. So declaring this really is a serious threat to the public as well, not only the disease per se, but there are other so many issues, economic sector. You imagine what would be a get loss for that. So we are equally concerned of the human loss. So you have to equate that, and this is definitely serious challenge, and WHO is very serious about equating those things, keeping in mind not only the disease but other aspect too should be also considered.
So what you are saying is that it is very difficult for health experts to arrive at this decision.
Yes, very difficult.
And we are already seeing China's economy taking a lot of hit because a lot of evacuation is happening, and British Airways yesterday suspended all flights to and from China. United States is considering that option already. Dr. Biswas, what is it that we can do to prevent any kind of influenza general or novel coronavirus?
See, one is a very important thing that during this time, one should not go around, because at this moment, we should not go into the crowded places where we find probably people are living with the infection and likely to catch, because this is human-to-human transmission, and the droplet infections, that really is the mode of transmission. People are sneezing, coughing, and this, again, second mode of transmission is the contact. So contact, we go closer, and then I would advise at this moment that one should not shake hand with the others at this moment, because through the shaking hand we may get contact with the viruses and then can affect one individual. So to avoid handshaking, and also sometimes we hug each other, people coming, and then so close contact I would advise not to go for, and coming closer, those things should be. And then washing hands is very important. And before anything, that if any doctors, this healthcare setting, mostly at this point of time, healthcare workers, those who are taking care of after seeing the patient, or any ill at the home also. If you think somebody is ill, you should wash hand and after also. And then one should avoid going out if somebody is infected and flu-like symptoms. Should not go out, should take rest at home, and if immediately go to doctors and take the advice. The next most important thing, that eating also is important. The eating habit, that we should wash hand before eating.
Right.
Properly.
So what you're effectively saying is everyone should wash their hands very frequently, not shake hands, avoid close contact with anybody with a cold or flu-like symptom. In fact, the government has said maintain a distance of at least 1 meter from anybody who has cough, cold or fever right now. Thank you so much for your time.
You were listening to a discussion on coronavirus and preventive measures. The participants were Dr. Ashutosh Biswas, medical expert, and Aditi Tandon, journalist. This program was produced and presented by the News Services Division of All India Radio. This program is also available on our website newsonair.com. You can also follow us on the News on AIR app for updates. You may email your opinion about this program at airnsdtalks@gmail.com.